Hi, my name is Abby. I'm here, I'm your nurse. I'm going to be doing a newborn assessment on your newborn. I'm going to provide privacy and do hand hygiene. I have checked the charts for the birth history. I've also conversed with the parents, and there were no complications with delivery or with the newborn after delivery. So I'm going to start with the general survey, which included the birth history and the vitals, which were temperature, pulse, and respirations, all within normal limits. And I'm going to move on to head circumference, which you do right at the eyebrows, and all the way around the head at about 8 inches. I'm gonna do the same with the length from the tip of the head to the toes at 9 inches. And lastly, with the chest circumference, which is at the nipple line, and that's at about 9 or 9.5 inches. So everything is within normal limits with the circumference, the length, and for weight, I would put the infant on a scale with a blanket to keep the temperature up. I'm now going to move on to the general appearance, and I see that the body of the newborn is aligned and symmetrical. I see that I've assessed the cry and there's no anything abnormal with that. And the muscle tone, you can tell that the infant is slightly flexed and they're not flopping around, so muscle tone is within normal limits. And then moving on to the skin, I see a little bit of the vernix, and that's just white residue on the newborn skin folds that you can see. And I don't see any milia, which is the white bumps that you can find on the bridge of their nose. I see a little bit of lanugo, which is just hair that some newborns have. I don't see any erythema toxicum, which can be irregular, red blotches on the newborn. I don't see any Mongolian spots on the back. Those can resemble bruises, which should be documented if you see those. And petechiae a little on the forehead, but that can be from crying, etc., but nothing to be alarmed about. And I'm now going to move on to the head, touching the anterior fontanelle and the posterior fontanelle. Neither are sunken in. I do see a little bit of molding, but that's just elongation of the head that can be from a vaginal delivery. And I don't see any cephalohematoma, which resembles bruising in the skull, or caput, which is just swelling in those same areas that a cephalohematoma can be found in. And I do note while I'm at the head that the face is symmetrical. And I'm gonna move on to the eyes now. And I'm just looking at them and I can see that they're symmetrical and aligned. They're not off-centered in the face. The conjunctiva are moist and pink, and there's a little bit of strabismus, but that's normal with the newborn. So I'm just gonna shine my light on each side, and I see that the pupils are equal. They're about 2 millimeters before constriction, and they're a little bit sluggish on reaction to light, and you can try accommodation, but it's just not there for the newborn, and that's totally normal. I'm gonna move on from the eyes to the nose, and I'm gonna occlude one nostril of the baby, and I can see that he's breathing in and out, and the other side, so patency of the nostrils. I'm gonna move on to the ears. They're well formed and fully developed, and you can tell by being aligned with the top of the eyes. And moving on to the mouth, I would have a gloved finger, and I would stick it in the mouth and touch the soft palate and the hard palate. You wanna make sure there's no openings or bumps, which can indicate a cleft palate, as well as I'm gonna shine my light looking at the gums and rubbing my finger to make sure there's no Epstein pearls. And while my finger's in the mouth, I have the sucking reflex, and I've already assessed the swallow reflex prior to when the baby was feeding. I'm gonna move on to the neck in the clavicle, I'm just going to press. There's no cracks or they're not off-centered in any place, which could indicate a clavicle dislocation. And when I move the arms, I don't hear any crepitus as well. Moving on to the chest, I see that the chest is symmetrical. He's not breathing too heavily or off-centered. And just to look at the nipples, they are symmetrical and about 2 to 3 millimeters in size. And when palpating, I don't feel any engorgement on the nipples. So I'm going to listen to the breath sounds of the newborn. I'm going to take a ladder approach. I find it easier to use the bell. And same thing on the back side. I don't hear any adventitious sounds. I hear just normal lung sounds. And then while I'm on the chest, I'm going to do the apical rate, and that's just found at the mitral area. I would listen for a full minute. And I got within the normal range of 110 to 160. And lastly, I'm going to listen for a murmur. I don't hear any sign of a murmur. I'm going to move on to the abdomen. When I'm inspecting the abdomen, I don't see, it's not distended. If it was slightly distended in a newborn, it would be normal. It seems to be symmetrical in appearance. And when I look at the umbilical cord, I see 2 arteries and 1 vein, and it seems to be drying up a little bit, which is normal for the umbilical cord. And I'm going to listen to the bowel sounds, starting with the upper left quadrant. I hear normal active bowel sounds. That's normal. They're usually present pretty soon after birth in a newborn. I have assessed the voiding patterns in the diaper, and they seem to be normal, as well as I check the chart and ask the parents about the meconium, which is just the first bowel movement after delivery of the newborn. I'm going to move on to the genitalia. If this is a female, I would check for discharge, and more alarming so would be blood in the discharge, and I don't see either. And I'm making sure that the labia covers the clitoris, and it does. And if this was a male, I would check the meatus location, which is at the tip and midline of the penis, and the testes location is in the inguinal tract, which is normal. And there's a little rugae on the scrotum, but there's no issue with that. And like I said, I just assessed the voiding patterns. I'm gonna move on to the back and the spine. And I'm just gonna run my finger across the back just to make sure there are no dimples or holes that could show any spinal defects. I'm now going to do the extremities, starting with muscle tone, which we addressed. There's no flopping extremities, as well as equal and bilateral movement. The hands and the legs, they work together. They're all moving. And the range of motion I can assess, I would bend at the ankles, both ankles. I would bend both knees. And then while I'm abducting and adducting the hips, I would check for hip dislocation that happened during birth. And I would hear crepitus, but I don't, so there's no hip dislocation. And I would do the same with the wrists and the elbows and the shoulders, and all the range of motion is equal bilaterally. I'm gonna count each digit on both the toes, and there's 10 toes, 10 fingers on both the hand and the feet. And then I would assess the feet for just location, and they seem to not be off-centered or anything. Check the bottom and everything's good. And the nails go to the end of the fingers. So, and we just want to check on that when assessing the babies. So I'm gonna move from extremities to reflexes. I'm gonna start with the Moro reflex. And the Moro reflex is when you when you hold the arms up and then you start to lower them and they have a startled reaction. Moving on next would be the tonic neck reflex. You would tilt and they would pull the same side arm up and the opposite arm down. This is also why it's called the fencing reflex. Arm up and down. And then the Palmer reflex, I would put my fingers in the palms of their hands. They would curl their fingers around, so that's a positive reflex. And same with curling the toes around my fingers. And then the plantar reflex, I would push the bottom of their feet and they would kind of pull away a little bit, and that's a positive plantar reflex. And the rooting reflex is when I touch my finger across their cheek and they turn their head and open their mouth on the same side that I did that to their cheek. And then I would do the stepping reflex, and I would hold the baby up and they would begin to take a little bit of steps. And I'm gonna do the Babinski, which you can see that I would run my finger up and around and they would fan out their feet, and I would do it on both sides. And then I would flip the baby over and I would do the trunk incurvation or the gallant reflex. And I would run my finger down one side and they would tilt their body on that same side, and that would be a positive reflex. And while I'm on the back, I'm gonna make sure the anus is patent. And I checked in the chart that it is patent from when they did a rectal temp. And lastly, I'm gonna do the behavioral status. And this newborn was active alert during the assessment. There wasn't any uncontrollable crying, and they weren't sleeping the entire time.